All right, well, we'll get started, and if anybody else hops in, then the more the merrier. So my name is Kristin Rocheleau, for those of you who don't know me. And I just thank you for giving me some of your time today to talk about the Priority Health mid-year review of what your value-added benefits are. And so first, we're going to start out with who our team is, which some of you already know. Of course, you all know Nancy as your health insurance advisor. And then I joined the team last May, and I work alongside Nancy doing the same thing that she does. So we're both independent insurance advisors, meaning that we have access to multiple different insurance carriers, not just one specific insurance company. And we also do other types of ancillary products, such as final expense, long-term care, life insurance, and many other products. So for those of you who received my email with the attachments, I did include one of the attachments in there of some of the other products that we work with. So if you do have any interest in talking further about that, or if you'd be interested in attending another seminar or webinar to those topics, please let me know. I did also include, there should be, I don't think yours is necessarily pink, but this morning we had an in-person seminar, but there's an evaluation form in there, and it would be, I would greatly appreciate it if you can fill that out at the end, just kind of give me some feedback. And then also if there are any topics that you are interested in hearing more about, you can put that on that form and then just email it back to me. I did send a little outline if you wanted to follow along with that. Otherwise, of course, we just have the slides here too that you can follow along with, okay? And a little bit about myself. So I started back in May here. I am a Davenport graduate with I have my business and health administration, and I worked at St. Mary's for a while. And then after that, I worked with a medical staffing company. And then, of course, like I mentioned, last May, joined the team here. So some of our other admin on the health side, because we have the wealth side and the health side here. We have Lauren, Lauren is here today, you can see. She will be going on maternity leave soon, which we're very excited for her and her family. And Lauren helps us with a bunch of our admin back of the house stuff, but she also has her license as well. And then we hired Amy just recently to join our team, which we're excited to have her along. She's very knowledgeable, and I'm sure many of you will be working with her soon, along with myself. We also have Sherry, who is Nancy's sister, and she helps us with different admin things, back of the house, administrative duties, and then Sherry's part-time. So without further ado, we can get started. So basically today's webinar is just to, let's talk about, are you taking full advantage of your Priority Health value-added benefits? I'm going to do an overview of what these benefits look like, but it's going to be no specific concentration on the medical side of the plans. But if you do have any questions on that stuff, you can definitely, we can talk on the side and I can answer any questions about your specific plan. And then I will do some questions at the end. And as we go, you can ask questions if you'd like. So I'm just gonna get this window out of here so I can see all of this. All right, so this year, Priority Health for 2022, we have 9 plans. They all have a $0 medical deductible as long as you are within network. And your monthly premium is going to be based on the county and zip code in which you live in. And also the county and zip code will also determine what plans are available to you, because not all of the plans are available in every county. Within those 9 plans, Priority Health has a rating this year of 4.0 or 4.5, and that's a star rating. That's going to be out of 5 as being the grand total. So they have great ratings on their plans. Every fall, the Centers of Medicare and Medicaid put out this star rating. And then the network choices that are offered with these Priority Health Medicare Advantage plans. We first have the PPO, which would be like the Edge plan. Do any of you have the Edge plan?
Yes. Probably cool.
So the Edge plan is one of the popular ones, but that is going to be the PPO plan. So with a PPO, you're going to pay less if you use the providers that belong to the plan's network. It also offers a greater flexibility to use providers out of the network, but at a higher out-of-pocket cost. And then the HMO POS, that's going to be like the key plan. And that is if you use your providers within the network and pay less. And then the POS portion of the plan allows you to use out-of-network providers, both within Michigan and outside of Michigan. But you will pay a little bit more if you're obviously outside of the network. And that is going to be one main focus too today, is all about staying within your network. So all of the plans have a maximum out of pocket. It's going to vary by plan what that maximum out of pocket is. The maximum out of pocket, once you have met that, then Priority Health comes in and they pick up 100% of the costs when you go in and seek services. Your co-insurance and co-payments are going to be feeding into that max out of pocket, but then your monthly premiums and when you go to fill your prescription drugs, those do not feed into the max out of pocket. And pretty much the max out of pocket is worst case scenario, the catastrophic. Not a lot of people actually end up meeting their max out of pocket, but it just lets you know worst case scenario, this is what you are exposed to. And then for the rest of these bullet points, I will be speaking further in the next slides, but they all have the Part D prescription drug coverage. They all offer worldwide coverage for emergency or urgent care. So you can be here in West Michigan, or you can be in Paris, France, or Nashville, and you can still get emergency and urgent care. And then some of the included extras that are built into the plans, we have our preventative dental, vision, and hearing. And then 6 of the plans have the over-the-counter purchase is another benefit. And then they all have the health club membership. So we'll touch base first on the embedded preventative benefits. So for the dental, as long as you remain, again, we're going to really focus on remaining within your network, but if you remain within the network, it's going to be Delta Dental. You get 2 dental cleanings, 2 exams, the 1 bite wing x-ray, and 1 brush biopsy per year. Now, just make sure your dentist works with that network and that will be included, and then you don't have to pay more when you go to see the dentist. For your network for vision, you have to be within the iMed network. And that's going to give you the 1 vision exam, 1 retinal imaging test. And then the eyewear allowance this year is going to be $100, and that is built into the plan. For your hearing, it's 1 hearing exam. And then they do offer affordable hearing aid pricing. So if you do purchase hearing aids, and that network is going to be with this True Hearing Network, if you do purchase the hearing aids, that includes a 60-day trial period and then 1 year of unlimited follow-up and 80 batteries. So now that we've talked about what's built into the plan, there of course is going to be an enhanced dental and vision that you can get a buy-up on. But however, if you do decide to add that, you only have specific times of the year that you can add it onto your plan. So these are the 3 times of the year which you can add it. And this another big focus of today's seminar is also just a big reminder that open enrollment season is really not that far away. It starts October 15th and goes until December 7th. Any changes that you would like to make to your plan, we can review at that time. And then even if you want to stay in your current plan, but you want to add the enhanced dental and vision, we can add it then, and it would be effective January 1 of 23. The next period, you do get this grace period. you could stay in your current plan or switch to a different. And if you decide in January, hey, I want to add this enhanced dental and vision, you can add it in January or February. And then the last option, of course, is when you're first coming aboard with Priority Health Medicare Advantage plans, you do have 60 days from your initial enrollment time to add this piece on. So the enhanced dental, we'll talk to first. Now the dental and vision are both going to be together, the enhanced. The price is going to be $23 per month if you have the key plan. And then all the other plans, if you decide to have the enhanced, it's going to be $29 per month. Again, big focus on the network. So Delta Dental, you must remain within that network. And it's going to include basic dental services. Now I know I've listed them all here, and if you'd like, I can also send you the slides if you want to take further notes on these, but just a couple fillings, crown repairs, and anesthesia are included. But then as you move on to the more major dental services, it's going to be covered at 50%, which is better than if you didn't have it. But the simple extractions, for example, those are 50, or if you go to get crowns, bridge repaired, any of those other oral surgery items, those will be at 50%. And then the implants and implant services, those are per tooth every 5 years at the 50%. Now this year too, they did up their yearly limit, which was nice. So you do have $2,500 within your calendar year on the enhanced dental to use. Oh no, I apologize. My slides just took a turn very far. Okay, so the enhanced vision is going to be, again, staying within that network is going to be the iMed network. So in addition to that embedded $100 that you have in the plan, you get an additional $150. So giving you $250 for the year to use towards frames or lenses, contact lenses, any of those items. And then I know I'm going to say it over and over about the network, but if you do stay within your network, then you get that eye exam and retinal imaging will be included at no cost. So we want to make sure that you are getting that benefit. Priority Health is always trying to encourage a healthy lifestyle, and these are some of those healthy lifestyle options that are built into the plan. So we'll first start with silver sneakers. Are any of you guys using the silver sneakers? Yeah, good. So the silver sneakers is basically it's a zero cost gym membership. If you're not using it, you just need to go to silversneakers.com and create an account. You can go in and put in your zip code, and then it tells you all these participating gyms. There's over 15,000 locations that do participate with this, and it's at a variety of different workout levels, different styles of classes, all kinds of things that are available to you. And that's not just in Michigan. So if you're traveling somewhere within the US and you want to say, hey, I wonder if they have some classes available in my area, you can always look that up, and the chances are there could be some locations around you. Now, another level, I would say, of the silver sneakers, they have this tuition rewards program. So when you go and you're going to your gym that participate with the silver sneakers, if you go at least 7 times within the month, that equals out to 250 tuition points, which is $250. Now, they participate with hundreds of colleges and universities. You get to pick who your beneficiary is. So it can be an immediate family member or an extended family member. And this one stipulation or guideline on it is you do have to have this person signed up onto your account by August 31st prior to their senior year of high school for them to be eligible. But it's just truly a great way to give your grandkids or a niece or nephew or anyone that you wish to be that beneficiary extra money for school. And then if you go into the silver sneakers into your account and you can go do a search. You can type in this tuition reward and it'll come up and you can look to see what those list of colleges and universities are. The Brain HQ, I was curious earlier this morning if other people were participating in it. Are any of you guys, have you tried that Brain HQ?
Nope.
Well, the Brain HQ, basically, if you like puzzles, you might enjoy doing the Brain HQ. So I even signed up for it just to kind of see what are our clients seeing when they go to log in. And it's a daily puzzle or different memory tests and things like that that they do. So just to keep your mind sharp and all kinds of different things. But you can do it with your computer, tablet, or phone. And I did include in the email that I sent you, there is a 2022 directory for priority health that I don't know if you guys can kind of see here, but it looks like this. And this one, it has everything that we'll speak to today, all of the information on there. So if this is something that you would be interested in, just go to that form and then you can go to the website and create an account and play some of those puzzles if you wish to.
That's a very handy sheet.
Yeah, that one is. It does have, it includes all the stuff and even their hours of operation. And
Yeah.
so that one is a good one.
It's great.
Good. And then the My Strength. So that's, we say that's like a health club for your mind. It's 7 days a week. They give you access to a therapist, and whether it's for emotional or physical challenges, really anything that you want. What are you looking for to help reduce stress, improve sleep, manage chronic pain, but all of that from the comfort of your own home. And then the acupuncture, that one they changed a little bit from last year, but this year we have, it does include for chronic lower back pain. And then you can also get 6 additional acupuncture sessions for other diagnoses. And then we have the over-the-counter one. So the over-the-counter one, I hope you're all using that one. But this is what the card looks like here up on the top right. And when you do receive your card, you do have to activate it. I did include on those attachments too, just a little kind of what to expect when you first get your card, but also on the second page of that attachment is a website that you can go to so that you can see how you can order them. You can get the catalog that way. You can order in store, online, over the phone, but it just really tells you how to do it. And you can find out the different stores that participate if you did wish to go in person. And then the catalog, of course, includes so many things. I mean, it's not just aspirin and supplements, like you can get Band-Aids and toothpaste, eye drops, knee braces. I mean, there's all kinds of things that are there. So it's definitely worth using. So depending on the plan that you have will depend on the amount that you get, but it's going to be anywhere from $25 to $75, and that's per quarter. So if you don't use it, then it will fall off. You can't build it up over the year. You do have to use it. But then the next quarter, of course, your portion would get added again. Another kind of section like we talked about with the Silver Scripts, having a tuition program, the over-the-counter has another section of theirs, and you can save possibly up to $2,500 in food savings for the year on eligible groceries. And that too, you can find on the second page of that attachment. And if for some reason it didn't come through or you have other questions, I can always email you that again. But that website is just great because it has everything on there. So if you are interested in these food savings and figuring out which grocery stores are eligible, you'll go to that website and then you can sign up for weekly emails to see what stores they have what deals and stuff. So they do offer a lot of healthy options from produce to lean meats, yogurts, all kinds of things, but that's a big savings if you look at it over the course of the year. Now, the over-the-counter is not available in 3 of the plans, and that's gonna be the Merit, a Medicare, and then that Select plan. Mom's Meals, this is a newer addition. And this is going to be where Priority Health will actually call you. They should be calling you over the phone after you following a discharge from an inpatient hospital stay, psychiatric, or skilled nursing facility stay. And they'll call you to see if you're interested in receiving at-home meals. So they'll come to you all prepackaged, ready to go in the fridge, and then you just reheat them. You can get up to 28 meals, so they'll do 14 each delivery. And then this is a service that you can utilize up to 4 times within the year. So if it's something that you're interested in after coming home and you need more time, and this is just a really nice, easy way to get proper nutrition, and they even cater to specific diets and stuff if you have dietary needs. So the Part D prescription drug coverage, as I mentioned before, that is built into all the plans. The Express Scripts is going to be your mail order. Do you guys do any mail orders for those of you that are on? Yeah.
Yeah.
The mail order is nice because, I mean, it just comes right to your house, 90-day fill. But if you have drugs that fall under tier 1 and 2 medications, you don't pay any copay. So that is a really nice perk with that, because if you were to go to your preferred pharmacy or standard pharmacy for a tier 1 or 2 medication, you would pay something. And while it might be $4 for one, or like it's lower, if it is with the Express Scripts, the nice part is that it would have a $0 copay. And then with, of course, preferred versus standard, we always say, go with the preferred. It's gonna save you the most money. And you can even go on to Priority Health's website, and down at the bottom of the site, there's a little spot where you can check to see pharmacies and even where your drugs fall on what tiers and stuff. So if you're ever curious, we can always walk you through that if you have other questions. A great additional savings tool that you can use, which I just wanted to bring up, this isn't something that's built into the plan, but is GoodRx. GoodRx is a great way to just look online. You go on goodrx.com and you put in your medication and dosage, and it will come up with all the pharmacies and the costs that they have for that drug. So if you are paying a lot for one, this is definitely, it's always worth looking, because you never know, you might be able to go to a different pharmacy and pay less versus going through the plan that you're on. Now this year, the Key Plan and the Value Plan, they are offering a $35 select insulin coverage, which is really nice for those who are managing their diabetes. And there are 5 insulins that they are covering for this. So every time you go to fill it, it's going to be 35. So that's going to be the Humalog, Humulin, Lumjev, Lantus, and Toujeo. Now, if you did fill those, and we'll say you have other drugs that ended up putting you into the donut hole, these will still always be 35 when you go to fill them. And then moving on to the gap coverage, or also we call it the donut hole. If you are in the donut hole, all of your retail drugs for your brand name and generic, you would pay 25% of that retail cost. So some other benefits too, we have, it is going to be a $0 copay as long as you remain within your network for virtual care, including behavioral health. You can see your primary care physician, a counselor, you can even see a specialist this way, such as a dermatologist, without having to leave the comfort of your home. And then we mentioned, we didn't mention before, but there is a no cost physical exam. But then we did mention the preventative built-in benefits, which were the dental, vision, and hearing. The free to talk to doctor, that kind of goes along with what I just first mentioned, but you basically can reach out to your doctor and speak to them outside of your annual exam for unrelated things. But I do know a lot of platforms nowadays, it seems like they have their, like a My Chart or something, and you can go in there even quite easily to speak to your doctor, send them a little message or send the nurse or something in the office. So that's also a nice perk to get some information speedy. So another benefit that's built into a few of the plans, only 3, is going to be the Papa Care. And that is on the Edge, the Compass, and the Ideal plan. So the Papa Care gives you up to 6 hours per month where a college student would come into your house and they would help you with maybe transportation or house chores, technology, any other senior services that maybe would be needed. So usually those college students are ones who are going to school to do something along those lines. Maybe they're going to nursing, but something medical usually. And then also for those plans that have the Papa Care, you do have unlimited Papa Care concierge. And that's going to be a team of individuals who you can call at any time, and they can help navigate your benefits with you, schedule a doctor's appointment, even help you find a doctor if you need to. And then there's a lot of other options that they can assist you with. So for those of you who are snowbirds or just enjoy to travel, they have this new travel pass. So the travel pass is going to give you worldwide coverage at an in-network price. So as long as you're seeing someone who participates with Medicare, you can still be receiving your in-network pricing. And the multi-plan Medicare Advantage networks gives you that access to find providers outside of Michigan, so they can help you with that as well. However, the odd part is it does exclude the Upper Peninsula of Michigan, oddly enough. You would think you couldn't travel to another state. It seems silly to me, but yeah. For whatever reason, the Upper Peninsula, they have a lot of the Blues, like Blue Cross and all of that up there. You can still travel to the UP, of course, if you're on vacation and you have emergency, you can still go to urgent care or ER. So just know that you can still seek the care, but you probably wouldn't want to go up there to find a new primary care physician while you're on vacation or something. And they do offer the Assist America. And this is going to be a global emergency assistance program. So basically, as long as you're away from your home, 100 miles away from home or more, this is a program that you could call. And then on the back of your travel pass card should be the number for them. That also is included on that attachment that I sent you. But this is a really, really nice service that they do offer, because if you're in another country and you need to coordinate some kind of medical emergency, you can call them and they will tell you where to go. They can help you find a doctor. They can help you fill a prescription. They can actually even help you locate lost luggage if needed. So they do a lot of stuff to help you while you're more than 100 miles away from home. Have any of you guys had to use any of that? The Assist America? Okay. Just curious. Okay, so this kind of just sums it up. It is just a little mid-year review here, but we just really want, at the end of the day, we want to make sure that you are taking advantage of all of your benefits. And since so many of them are at no cost to you, we want to make sure that you are aware and know about all of them. Make sure that you set up your member accounts. The first one, of course, would be to start with Priority Health, because then you can go and see your premium balances, download any invoices, and just manage your account to see where you are. But also you have the Silver Sneakers. You can do that one to have that account. The over-the-counter account you can do to receive that email for the food savings that they can email to you. And then our other big focus, the open enrollment time of the year, this is going to be when we would love to see you come into the office. We can do a review just to make sure that you are in fact in the best plan. We hate to see people just go idle and continuously to roll over into the same plan, because they'll only send you information about the plan that you're currently in when it comes to open enrollment time. But we just always want to make sure you're in the best fit for you. So the open enrollment is going to be October 15 and goes until December 7. And then we actually can start talking to you and start having meetings starting October 1st. We just can't write any of the business or do any of the enrollments until the 15th. And then that would go into effect January 1, of course. So I want to assure you all that you all have made great choices with Priority Health. They have great plans, and as you can see, they offer so many different added on benefits. So please remember that we are always here to help you. This year, you will definitely be hearing more from me, and then also Amy in the office, who I introduced in that second slide. But yes, thank you so much for attending today and giving me your time. Do you guys have any questions on anything at all?
No, but thank you very much.
Oh, and then if you do have any questions, can you just unmute so we can hear you?
Yeah, no questions, but thank you very much. This was really good.
Oh, good, good. And then too, if you don't mind, if you do have a second, I'd love some feedback. There's only 3 questions on that little attachment. You can even email it if you don't want to fill out the form, but that would be much appreciated.
Kristin, thank you for this. Not really a question, but something that maybe you can, some input into the Mom's Meals program.
Yeah.
I know last year I went through a knee replacement, and because a lot of those surgeries, even though they're pretty major, they do them outpatient, so you don't qualify.
Yes.
And when you're laid up with a knee or having done a shoulder back a few years ago, that would be a very nice perk to be able to take advantage of.
I completely agree, because yeah, so many more of those surgeries are just outpatient, and for the moms, yeah, they definitely, the Mom's Meal, sorry, they are an inpatient hospital stay. But that would be very valuable if they added that. Then they just had to maybe know, like, oh, you just had a knee replacement or a hip replacement.
Yeah, you don't get around real well when you go through those.
No, you said you had a knee?
Yes, yes.
Yeah. How are you doing now?
I still got a leg, so I guess that's good.
Aw,
Some people come out better than I did. Some people come out worse than I did. So I guess that's all well and good.
yeah, I know. My mom just had a hip replacement, and this was her second, and this one did not go as well as the first. So we'll see, but it's still really new. So
Well,
yeah.
prayers for her.
Yeah, well, maybe they'll add something like that onto the next year for 2023, and we can see, but we'll be able to, I'll hold another seminar. It could be 2 in person and maybe 1 online. We're kind of feeling that out, but it'll be in October for what that new plan information is. So then if you guys would like to attend that, that would be great.
Thank you.
You're welcome. Well, any other questions?
How long do you have to stay in the hospital for that Mom's Meal?
It's
If you have
just-
one overnight, is that enough?
It should be, because it's an inpatient hospital stay.
An
Yeah.
answer to that is you have to be admitted and not be for observation. When I did
Yep.
my knee, they kept me overnight just because I was too late to be out.
Like in the day.
Yep, and it was considered observation, and that did not qualify.
Ah.
Yeah, so that's how
admitted,
they
not
get around that.
observation.
You got to make sure you are admitted for whatever.
Yeah. Yep,
Interesting.
I know. It would be very helpful though for something like that.
Well, and the insurance companies are the ones that are pushing for more and more outpatient surgeries rather than inpatient. And, if they're providing this service, it's a give and take type thing. Okay, you're sending me home, and pretty well laid up for a few days, especially with
Yeah.
the pain meds and everything they give you. You're not exactly out skipping rope or anything.
Exactly.
Mhm. Very informative. Thank you, Kristin.
You're welcome. Well, thank you so much for attending, everyone. I appreciate it, and I hope that you all received the attachments. If you have any questions on anything, please don't ever hesitate. Just give us a call. We're always here to help, okay?
Thank you.
Okay. Were
All
there
right,
just,
well, you-
how many of us were there today?
So I had 7 originally signed up. It looks like 5 attended, but we did have a couple that reached out earlier and said that they couldn't. And then our in-person seminar we had here in the office, we
Yeah.
had 13 that showed up for that.
Well, that's good.
Yeah.
Yeah.
So,
The
you.
untechies.
yeah.
All right, thank you. Bye-bye.
All right.
I'll do
Thank
your
you.
evaluation.
Okay, thank you. I
and-
appreciate that. And
Yeah.
you have a great rest of your Wednesday, okay?
You
Thank you.
too.
Same to you.
Bye-bye.
All right, thank you. Bye-bye.
Bye-bye.